Pfizer, the Moderna vaccine, which one would you take if you get either one? The one I would get if I could take it, but it's not on the market yet, is from Novavax. It's a protein subunit. And they're a small company based in the East Coast. And I really like these protein vaccines. They're very safe. They're very efficacious when they work. If your adjuvant is really screwed up, they can cause some problems. But more often than not, they have a good side effect profile. And it's just an inert protein substance. They make it with moth DNA. They genetically engineer moth cells to create the spike proteins. But if I had to choose between Pfizer and Moderna, they're both relatively the same. The polyethylene glycol preservative that they put in there, it seems to be causing some side effects. Normally, anaphylactic shock occurs with vaccines 1 in a million. It's happening right now, 1 in 50,000. I read a paper that said that they think that polyethylene glycol is people have antibodies for it, and they're having immune responses to it. It's common in toothpastes, mouthwashes, laxatives, these things, but it's not common in injections. So that's probably what's causing some of the immune response in that respect, the allergic reactions. Now, the immune response in general is very, very strong. Everybody who gets it, they feel it. 80% plus have some form of adverse reaction, but they go away in a day or two for the most part, and we move on. Second shot's what's much worse. What about ivermectin? Ivermectin seems like it works. It's extraordinary to me that there's been little pickup from the FDA. A lot of clinical evidence, a lot of observational evidence. It's heavily used right now in Central America and in Asia, and a lot of critical care physicians are talking about it, and some small-scale placebo-controlled peer-reviewed studies. So it should definitely be part of the therapeutic bag. It's dirt cheap. It's easy to use. The side effect profile is relatively low. It's been on market for 40 years. I give it to my horses as an anti-parasite. It's not a new drug in any sense of the word. And I'm just blown away, absolutely blown away that ivermectin has not gotten more traction. And I think people are lumping it in with hydroxychloroquine, which was a bit more dubious in clinical evidence, but there's a lot more clinical evidence for ivermectin, and it kind of makes sense why it would work. And there's evidence it works with HIV, influenza, and other viruses as well. So stands to reason why it would work with the coronavirus.